So let's take you to that briefing, and the Minister, Dr. Joe Phaahla, his deputy, and of course other stakeholders, they are in conversation, bringing us up to speed with the latest.
Followed by the closing remarks by the Honourable Deputy Minister. So without wasting any time, I'm going to hand over to the Honourable Minister, Dr. Joe Phaahla, to give us the message of the day. Over to you, Minister.
Thank you very much. Thanks, Foster. I hope, I don't know what my computer is doing with me, but I hope it's still visible. Thank you very much for this opportunity, and good morning. I hope the Deputy Minister has been able to join. Also greetings to our guests for this morning, Dr. Wasila Jassat and Dr. Michelle Groom from the NICD. We are pleased also to be joined by Dr. Ntsaki Maluleke from the Gauteng Department of Health, and also from the National Department of Health, a team which is led by Dr. Buthelezi, Dr. Nicholas Crisp, and I think Mr. Murawani and Mr. Naidu and others are also on the platform. And good morning to all South Africans. 8 days ago, we announced, together with our medical scientists, who were led by Professor Tulio de Oliveira, that they had identified a COVID-19 variant which could be associated with a sudden rise in new infections. About 7 to 10 days before that, we had started to recognize a steady rise in new infections from the low levels of around 200 to 300 cases per day, which we are recording, to a steady rise starting at around 500 to 600 a day, rising steadily to 700 to 800, and then suddenly also surpassed 1,000 cases per day. Analysis of the geographic distribution had shown that these were limited still to Gauteng, and mainly starting in the Tshwane Metro, and even some districts could be identified, some of it closer to the TUT campus in the Tshwane Metro. The confirmation of the new variant in this Tshwane area explained the steep rise in new infections. And it was showing that this could then be attributed to this new variant which our scientists had identified. The steep rise was also going beyond the Tshwane area, spreading into the rest of Gauteng, into Johannesburg, into Ekurhuleni, and also a little bit into the Sedibeng and Western areas by the time this finding was announced by our medical scientists. It is now history that the World Health Organization, after the report by our scientists, confirmed that it is indeed a variant of concern and named it Omicron. Because I'm emphasizing the variant of concern because we have been long alerted to the fact that this virus would be mutating at a regular basis, and that there will be now and then some variants, but some of them may only just be variants of interest and not really of concern, in that they would not cause a lot of change in the epidemiology. We again want to take this opportunity to thank our team of scientists who really worked very hard in identifying this variant, which was subsequently named Omicron. We want to thank the genomic network, the genomic surveillance network, for their hard work and diligence. It is indeed a matter of regret and a reflection of hypocrisy by some of the countries that while their leaders, without exception, are singing praises of the expertise and also the openness of South Africa, but they still went ahead to slap us with travel bans, which included also many of our neighbors in the SADC region. Over the last 7 days, we have expressed our own outrage and disappointment at this misguided and counterproductive action by some of the countries. But we want to thank the vast majority of nations which have not followed this destructive path, which undermines international cooperation and solidarity in the common fight against the COVID-19 pandemic, and others are still coming on. And we also want to thank all those who have stood with us and supported us while we had to go through this very difficult situation, which has got a serious impact on our economy. As we were entering the second wave of COVID-19 around this time last year in 2020, our scientists, even at the time led by Professor Salim Abdul Karim, told us that we should expect mutations of the virus, leading to various variants of this virus, and some of whom would be serious. At the time, we were being introduced to the beta variant, which hit us around this time last year. They warned us that the variants would generally be more transmissible, but most of the time they would be less severe. Today, as we enter the fourth wave with a new variant, we can see confirmation of this warning. We have moved from a total of around 2,465 new cases last Thursday when this variant was announced, to yesterday's highs of 11,535 yesterday afternoon, a rise of just over 9,000 new cases per day within 7 days. What we can say is that we actually were alerted, as I've indicated before this fourth wave, that it was coming, but we didn't know how soon and what special characteristics the new wave would take in terms of whether there would be variants and what would be the characteristic of those variants. As can be seen from the steep rise in numbers over the last 7 days, and as we will see from the presentation by our NICD team, the curve which depicts this rise in infections is very steep, which is much steeper than any other rise and curve which we have seen in the previous 3 waves. What we must re-emphasize is that while our scientists and those also colleagues, medical scientists in Botswana, who we must also congratulate for this hard work, while these were the scientists who first discovered and reported this variant, no one really knows where this variant originated from. We know that gatherings and social activities like parties and other big gatherings, close gatherings, are super spreaders, and that as we have indicated in the introduction, that when we started seeing the rise, they could be identified to particular areas in Gauteng and in the Tshwane Metro. Some of it was, as we said, closer to the Tshwane University of Technology. Over the last 7 days, the new spike has moved into the whole of Gauteng, and it's also registering presence in all our 9 provinces, with numbers starting to rise in the Western Cape, in KZN, in Limpopo, in the Northwest, and in Mpumalanga, also with high positivity rates. Currently, only the Free State and the Northern Cape are still showing relatively low numbers and low positivity rate, even though even with them, we're not talking about the 1 to 2%, but between 3 and 5% positivity rate. So every area in the country is starting to register high levels of infections. As will be confirmed by our NICD team, while we are still dealing with few days and limited data, indications are that this variant is indeed highly transmissible, including infections of people who have been vaccinated, but are causing mostly, but the infections are causing mostly mild illness, especially for those who are vaccinated, with hospital admissions mainly dominated by those who are not vaccinated, and young people below the age of 40, most of whom are not vaccinated. At this stage, we can say that even in Gauteng, which accounts for 72 to 80% of the new daily infections, we have not yet reached threatening stages in terms of our hospital capacity and the new hospital admissions. The total current active cases stand at just over 47,000, with hospital admissions just below 3,000, with significant spare capacity in both our public health facilities and also in the private hospitals. New cases increased by more than 300% in the last 7 days, and positivity rate is now, as of yesterday, at 22%, up from the lows of 1 to 2% about 2 weeks ago. At this stage, the trend is indeed that of a rapid rise in cases, but we hope that the mild nature of the illnesses amongst those who are infected will continue to be the dominant feature. Our Gauteng team and the national team will confirm that we are doing everything possible to make sure that we can handle the provision of health services for those who will become seriously ill. One change that is threatening to destabilize is that even though most of our vaccinated health workers who get infected have mild symptoms, they still have to isolate, leading to possibilities of shortages, as we can see in some of our hospitals while they are in isolation. So we will have, together with our colleagues in the provinces, starting here in Gauteng, we will have to address this phenomenon that even though the health workers who are infected have mild symptoms, they still have to go into isolation. We want to appeal to all South Africans that the time is now for more vigilance, to apply all our tried and tested health and safety measures, which we know very well, which our president also has emphasized on Sunday. That is the wearing of masks, hand washing, sanitizing, physical distance, avoiding crowds, and also being in areas which are well ventilated. Above all these measures, the main opportunity now, which is different from when we had the other waves, especially the first and second wave, is that we have opportunity to be vaccinated, which provides a major protection against serious illness. Above all this, therefore, let us take the opportunity to be vaccinated. We applaud all South Africans who have come forward to be vaccinated. As of last night, just over 16.7 million of us had been vaccinated, with over 26.1 million doses administered. As we speak now, 42.1% of all adults have received at least one vaccination dose, with 14.6 million, which constitute 36.8% of the adult population now fully vaccinated. As of yesterday, the Free State province became the first one to reach 50% of all adults in the province with at least one jab, and it should cross that 50% mark later today, while Limpopo province and the Eastern Cape are just on their heels at just over 48%, both of them, and we expect that in the next few days, they also will cross the 50% mark. So we call on all those who have not completed the full vaccination with the Pfizer vaccine. There are many who have taken only one dose, even though they've long been due for the second dose. We really appeal to them to come forward and complete their vaccination so that they can be fully protected. Because what we have also seen is that while having at least one dose does provide some protection, but it's just not enough, because it doesn't provide the full protection which is required. As we know by now, all adults and all children over the of 12 years and above are eligible for vaccination. This fourth wave, which we have started to enter into, can be managed. without too many casualties, without too much loss of life, if we all observe the safety measures, the biggest risk being gatherings, especially indoor gatherings. We are blessed with warm weather at this time of the year. So if we need to have gatherings, let's make sure that this happen outside where we are well endowed with fresh air. But if we need to protect from the hot sun, we can have the cover, but make sure that it's in a situation where there is a full fresh air. Just protect ourselves from the hot sun. And we also advise that even when you have evening gatherings, please, as far as possible, have them outside. But above all, we want to repeat again that we can save lives, save our loved ones and friends and work colleagues by making sure that we are vaccinated. While there are still some questions around the Omicron variant, while more research is going on, not only here in South Africa, but all over the world, the evidence that is very clear thus far is that, like all previous variants, our best protection against serious illness lies with the vaccination. We must therefore not hesitate to take the vaccine because of this Omicron variant. The vaccination provides our best protection against serious illness and death. We must remember that no one amongst our scientists had ever said to us that the vaccines will prevent us from being infected with the virus. They've never said to us that while we are vaccinated, our bodies the virus will never enter our bodies. But that what they've always said, and which we are seeing as these waves are getting into operation, that 80 to 90% when you are vaccinated, you will get mild illness. And as I've indicated, this is what, even with this variant, that's what we are observing. So vaccination is not just an option, but a major matter of saving lives, saving also livelihoods, because when we are, most of us vaccinated, we can have more economic activity. And we want to, and by vaccinating, we will also save many more of our gallant health workers from being overwhelmed with a lot of infections with this Omicron virus variant. We wish our health workers all the strength, all the fortitude and protection in the tough days laying ahead of us. And again, let us do everything to protect them by vaccinated. This weekend and the coming week have again been declared by our president and the deputy president as a Vuma weekend and week. And we again call on all South Africans to take the opportunity as vaccination sites, more of them will be opened over the weekend and as we go into the rest of the week. Thank you very much, Mr. Mohale.
Okay. Thanks, Minister, for that keynote message and update as far as we are as the country. Indeed, as things stand now, vaccine is the only or is the most effective weapon to fight this variant. So without wasting any time, I'm going to hand over to our